Mgonjwa hapa Hema Hospital nimekaa muda mrefu sana, kama vile tulikuwa tunalikuja kitambo tunalipiwa ile chahebu na tulipia pesa. Sasa hatujui ni nini imetokea saa hii. Tumepona tuko hospitali, NHIF tunangojea message. Hii pesa tunalipa kila mwezi. Inaenda wapi? Kama mimi nimelipa paka 2024 December. Hiyo pesa yote NHIF inaweka itaki kutulipia tutoka hospitali. Sasa Ruto tusaidie. Hata ile ya Linda mama nimesikia naye inapotea. Sasa tutafanya namna gani? NHIF tunalipa kila mwezi. Tutafanya aje sasa? Sisi watu wasiojiweza tutafanya namna gani? Sisi wala hatuna namna. Tumefanya kazi, tumeritaya, tuko nyumbani na tunaendelea kulipa NHIF. Na sasa ati hatuwezi tibiwa kwa private. Kwani private ikipotea tutatoa pesa wapi tuende kutibiwa? Serikali, Ruto tusaidie tafadhali.
For private institutions like ours, these companies, these payers, they affect our operations in a great extent because we treat their patients, they pay us later. But we are facing a serious challenge when it comes to payment, and this has grounded most of our operations. And if you don't get the monies that you have spent for patients, even getting quality service, offering quality service to this patient becomes a challenge because essentially there is no man to run the hospital. There is no man to pay salaries, so you'll find out you have demotivated staff. You find you have no money to pay your suppliers, so you find some drugs cannot be supplied. So ideally, if these insurances and NHIF can pay service providers, our community or our people will get quality service. They will get their drugs, they will get the best treatment from the doctors. You don't pay the doctors, you call them for an issue, they don't come because they have not been paid. So the insurances, NHIF, and any other corporate that has a medical cover for their staff, if they don't pay the service providers, believe you me, there will be a challenge when it comes to service delivery. And when you look at even the number of public hospitals we have and the number of private hospitals we have, the public hospitals alone cannot manage the population when it comes to healthcare. So even the private sector, the private hospitals, they have a bigger hand when it comes to offering healthcare to the people we have here in our region. Currently, like where we are restricted, we have vulnerable people, more so women, who use Linda Mama. If they don't get this service, believe you me, they will suffer. A patient comes here, at the look of the things, she has nothing. So Linda Mama has assisted these women. But now you realize NHIF is not paying claims. All employers are remitting this money. People are contributing, but the way the fund is being run personally, I say there is a problem which needs to be addressed. So I'm appealing to the government. If sincerely speaking, the government is caring about the welfare of the citizens, healthcare is a number one priority. Because if you don't have a health population, then even our GDP will be affected. People will be productive. So if the government can take time and work on these essential services to ensure that all hospitals who are contracted by NHIF, they are paid in good time, we'll have a very healthy country and people will work, and that will improve our economy. But the way things are now, I will tell you where I sit. I'm having over 100 employees who have not paid them their salaries. They have families they have to take care of, but there is no money. And when we look at how we are operating, in a few months to come, then you may find that we cannot continue the same way. So we are urging the government to ensure that these state corporations which are offering some services, they support the private sector. And I think we, as the private sector, we are the major players in the economy. If you close down private entities by not maybe supporting them financially, you are going to cause loss of jobs. I will close my hospital because I am not paid. So 100 staff will go jobless. So I think the government has to take this seriously so that our mothers can be safe, our children can be safe, our men will be safe by ensuring all these payments are done.